You know that nagging pain in your neck or that tightness in your chest after a really stressful week? We all just brush it off as tension, right? But what if it's actually a signal from your body pointing to something much, much deeper? Today, we're going on a pretty surprising journey from everyday stress to these tiny little knots in your muscles, and believe it or not, all the way to your heart. So, to really get this, we have to start with the guy who literally wrote the book on stress, Hans Selye. And his definition is just brilliant. He saw stress not just as a feeling, but as a physical process, the total wear and tear that life puts on us. And that one idea, that stress is a physical burden, well, that's the key to everything we're about to uncover. Okay, so how does this wear and tear actually happen? Well, think of your body as having this incredibly sophisticated ancient alarm system. Here's the catch, though. It was designed for, short-term threats, like a tiger jumping out of the bushes. But in our modern world, that alarm bell is ringing constantly. Now, you've probably heard of this alarm. It was first called the fight or flight response. It's that instant automatic jolt you feel when a car suddenly cuts you off in traffic or you get one of those emails from your boss. The thing is, your body doesn't really know the difference between a real tiger and a deadline. As far as it's concerned, it just needs to prepare for a battle. This is a perfect way to picture it. Your nervous system basically has two pedals. You've got the accelerator, that's your sympathetic system. It floods you with adrenaline, gets your heart pounding, and gets your muscles ready to go. And then you have the brake, the parasympathetic system, which is supposed to slow everything down and bring you back to normal. When you're in fight or flight, your body is just slamming on that accelerator. But Selye took it a step further. He figured out what happens when that stressor doesn't just go away. He broke it down into 3 stages. First, you have the initial alarm. That's the fight or flight. Then, if the stress keeps going, your body goes into resistance. It's trying its best to cope and adapt. But here's the dangerous part. If you stay in that stage for too long, you hit exhaustion. Your body's resources are just completely tapped out. And that exhaustion stage, that's where things start to get really physical. I mean, what happens when the alarm never, ever shuts off? When your body is constantly bracing for a fight that never comes? Well, it starts to build a defense. It creates a kind of muscular armor. Yeah, there's actually a name for it, visceral tissue armoring. It's a powerful idea. All that emotional stress we're carrying around literally gets baked into our muscles. And over time, we get so used to being tense that we don't even notice it anymore. It just becomes this subconscious shield that's quietly draining our energy 24/7. So, this muscular armor isn't just some vague feeling of being tense. It actually shows up in very specific, really painful ways that are, frankly, often misunderstood. So now we have to talk about something called trigger points. But first, a quick and really important clarification. A lot of people mix up myofascial pain syndrome with fibromyalgia. But as you can see here, they're really different. Fibromyalgia is more of a widespread all-over pain with what are called tender points. Myofascial pain, or MPS, is more localized, and its defining feature is the trigger point. And that's what we're going to zero in on. So what in the world is a trigger point? Well, Dr. Janet Travel, who was a total pioneer in this field, defined it perfectly. It's basically a tiny, super irritable knot inside a tight muscle. But here's the mind-blowing part. When you press on it, the pain doesn't just stay there. It refers pain somewhere else entirely. You push on a spot on your shoulder, and you might feel it in your head as a head. So how do we get these things? Well, it's a mix of stressors. It could be purely physical, right? Like you overdo it at the gym, or you sit hunched over a desk all day. But look at that last one on the list, emotional stress. This brings it all full circle. Your body's reaction to mental stress can literally create these physical, painful knots. And this is where the story takes a really surprising turn. Because these tiny little muscle knots, maybe buried in your chest or your shoulder muscles, can create a huge and honestly a very scary problem. It's a problem that sends thousands of people to the emergency room every single year. I know, it sounds impossible, right? I mean, a tight muscle is one thing, but how could it possibly have anything to do with your actual heart? So picture this. You feel a sudden, intense pain in your chest. Maybe it's radiating down your arm. You're short of breath. Every single symptom is screaming heart attack. But then you get to the hospital, they run all the tests, and the doctors come back and tell you your heart is perfectly fine. The pain, though? The pain is still 100% real. And this is exactly where Dr. Travel's work is so incredibly important. She discovered this fascinating two-way street. First, she found that trigger points in your chest muscles can perfectly mimic the pain of a heart attack. And get this, she even found that by deactivating these muscle knots, she could sometimes restore a normal heart rhythm in certain patients. But it also works the other way. A real heart attack can actually create these trigger points, leaving behind pain that can last long after the heart itself has healed.
So, okay, we have this very complex problem. The big question is, what can we do about it? Is there a solution? Well, thankfully, the research points to a really tangible, hands-on approach.
Yeah, according to the research, the answer isn't a pill. It's a very specific, targeted kind of therapy. Advanced neuromuscular massage is a technique that's designed to do one thing: hunt down these hidden trigger points and release them. It's not about just rubbing where it hurts, it's about being a detective and finding the actual source of the problem. And what's really cool is that the benefits go way beyond just fixing one knot. This kind of work boosts blood flow, helps your body flush out toxins, and promotes deep relaxation. You're essentially turning off that fight or flight alarm we talked about. You're finally hitting the brake pedal and telling your entire nervous system that it's safe to calm down and start to heal. And that brings us to the final and maybe the most important piece of this entire puzzle. Because it's not just about what a therapist can do for you, it's about what you can start to do for yourself. This isn't some new idea. 24 centuries ago, Hippocrates, the father of medicine, talked about a healing force of nature that cures from within. In a lot of ways, all this modern science is really just showing us the physical things, like these trigger points, that get in the way of that natural force. The healing power is already inside us. So I'll just leave you with this question. Our bodies are talking to us all the time. That tight shoulder, that shallow breath, that feeling of being armored up. What if we started to really listen to those signals? Could we learn to release these tensions before they take root? Can we actually reactivate that incredible healing force that we've maybe just forgotten how to use?